Christie Alexander from the FSU College of Medicine with us again today. She joined us live from that testing center. Doctor, thanks so much for your time. We understand it's your first time there at the center. What's it been like today so far?
So far, we haven't seen that many people riding through the center. It's been a little quieter this afternoon. I got here around 3 o'clock, but of course the center opens at 11 a.m. and they see the most traffic around those hours.
The medical professionals and government officials continue stressing the importance of testing and also, of course, trying to pick up the speed of what the turnaround for those tests are. We know that there is a lag right now in getting the results. TMH has told us some results are taking as long as 10 days to get back. Do we know why that is and how that's contributing to the growing number of cases?
We're not really sure why that is. There's so many tests that are being run at the same time. I think that's part of it, just the numbers of tests that are being run. But it really doesn't change our management, because at the end of the day, if you're suspected of having coronavirus or COVID-19, you're expected to stay home for 2 weeks and quarantine yourself. So even though it might be taking 10 days to get those results, the treatment is the same. Stay home and stay safe.
And doctor, we all know that workers are using protective gear in the health field, but we also know that there's a shortage of that gear. As far as you've seen there at the testing site today, are the workers properly protected, and do they have what they need to stay safe?
Yes, they do. They have plenty of gear here, thank goodness, because we wouldn't be able to do these screens without that. It includes everything from hair caps to eye protection to the masks that we've all been talking about. Of course, gowns and gloves, and all of that is in enough supply for our people doing the testing to do the tests safely.
Dr. Alexander, can you tell us more about the difference between the masks that are recommended for healthcare workers and the ones that the general public might be directed to wear?
Absolutely, I would love to. I actually brought my N95 mask with me today. This is an N95 mask. This is the mask I was talking about last week that we've been using over and over again when we usually don't do that. So these are the masks that protect us, the healthcare worker, from somebody who has COVID, from somebody who's sick, and keeps us well. Those are these masks here. Now you'll also see surgical masks around, and they look more like this. These are the ones that if we're not suspecting somebody has COVID, we're able to wear these just to protect ourselves, just for that added layer of protection. So those are the two main types of masks. Now, in addition, you may have heard a lot about I think I mentioned this actually, the bandanas and the cloth masks that people are making for our healthcare workers and things like that. While there is no mandatory mask, like at TMH, for example, they're not requiring everybody wear a mask, but if it makes those that aren't working with COVID patients feel more secure, it's completely fine to wear those cloth masks. And there's even a site, there's a specific way that they need to be made, and that can be found online.
Okay, Doctor.
But those are the three different types, and this one is the one that we've talked the most about right here.
Okay. And we spoke earlier in the week, we talked about the CDC and how they were exploring whether or not to direct the public to wear masks. They haven't issued any sort of mandate on that. Until we hear more from them, though, what is your recommendation about what the public should do?
Okay, my main recommendation for what the public should do would be to stay home and stay socially distanced. I hate to say that and beat that dead horse, but out of everything we're seeing across the board, everybody is saying the same thing, that is the #1 thing that will protect us all. Now, in regards to the public wearing masks, the tough thing about that is the more the public does that, the less supplies we will have for healthcare workers and for those that are caring for people who are sick. So we have to use our discretion with that. At the end of the day, if you're living at home with others and you are sick, then yes, you should be wearing a mask and you shouldn't leave your home. If you're out and about in public, maybe wear one of the cloth masks for now. It will add at least a bit of a layer of protection should somebody again, trying to stay 6 feet from each other, should somebody sneeze or cough. Again, these droplets are respiratory. They will land, the gravity will take them straight to the ground. So it's not airborne or aerosolized. It's not going to travel beyond that 6 feet, if that makes sense.
Dr. Alexander, going back just to the turnaround question as far as the tests are concerned, we've heard a lot about rapid testing and how that might become available hopefully sooner rather than later. Have you heard when those tests that could have that maybe 45-minute or, heck, we've even heard 5 or 15-minute turnaround time might make their way here to Florida or Georgia, our area?
I have not heard the status of that. We're hearing a lot about the fact that they're being made, but those rapid tests we don't know when they'll be available. And when they become available, they'll be first available in the hospitals so that we know what we're treating. I mean, that'll be number one. What are we treating? And then hopefully they'll make their way out to clinics and in places where we need to be screening people quickly.
All right, Dr. Alexander, as always, before we let you go, is there anything else that you want to mention that we haven't done so today?
Sure. I mean, one thing I would like to say is we are here, we're at our testing center. It's amazing what TMH and our partners have done. I'm an employee of TMH, but I wear a lot of hats. And I've been saying a lot, we're building this boat as we sail it, basically. And this is a beautiful example of exactly that. And we are staying afloat, and we hope to continue to do so. So we just thank everybody involved, tons of partners involved with this testing center, and we thank everybody for their support.
Dr. Alexander, before we let you go, I'm actually going to ask one more question because we had this into our newsroom, and that is, a lot of people right now trying to figure out, okay, can my kids play outside with friends as long as they go ahead and keep those social distancing requirements in mind? Is that something that folks need to be worried about out there? As long as they're staying 6 feet apart from their friends, can they still play outside with them?
If they can truly maintain that distance, maybe, but think about that. That's really hard with kiddos to keep them separated that far apart, 6 feet apart. So if you can really do it, I mean, even here, as we're hanging out with our fellow clinicians and the people that are here at this testing site, we want to be closer than we can be because that's just human nature. So we have to be really, really careful with that. And as things move on and the more people say, well, I don't know anybody who has this, I'm fine, it'll be okay, I can just go have a drink with a neighbor. Absolutely not. We believe that the surge is coming in 2 weeks, and this time is prime for us to be maintaining that social distance as much as possible.
Okay, Dr. Alexander, we appreciate your time and your expertise as always.
All right, stay healthy, stay safe, doctor. Thank you. And we'll make sure that this interview, along with all of our conversations with Dr. Alexander, posted to our website, WCTV.tv. You can view them there anytime you need. And if you have any questions you'd like us to ask, please make sure to send them our way. We'll be right back.